Alright friends, today we are going to discuss anatomy of tibia. This is the tibia bone. Tibia is the medial and larger bone of leg. I can say second larger. First is femur. It is homologous with the radius of upper limb. This whole is the tibia bone. Now it is features. Tibia has got an upper end, a shaft and a lower end. This is upper end of tibia. As you can see, this upper end has got condyle. This is medial condyle. This is lateral condyle. This is tuberosity, and this is the intercondylar area. This is intercondylar area. So the upper end has medial condyle. Firstly, we will discuss medial condyle. This medial condyle is larger than lateral condyle. The medial condyle has got one superior surface. This is anterior surface. This is medial surface. This is posterior surface. If we talk of the superior surface, this is articular and it is anterior-posteriorly oval. Its axis is anterior-posteriorly, it is oval, and it articulates with the medial condyle of femur to form the knee joint. It is central part actually is articular, and its peripheral part is flat, and it is separated from the medial condyle of femur by a meniscus that is called the medial meniscus. It has got a lateral margin which is in the form of lateral tubercle. This is what we call lateral tubercle. This is the whole superior articular surface. Anterior and medial surface has got numerous vascular foramina. These are the vascular foramina. This the posterior surface of the medial condyle has got a groove. This is grooved. Now the lateral condyle. This overhangs the shaft more than the medial condyle. It has also got anterior surface. This is lateral surface. This is superior surface, and this is the posterior surface. This superior surface is circular and it is articular, and it articulates with what we call the lateral condyle of femur to form the knee joint. And this is the circular, we can say. And it is lateral part, peripheral part is flat, and it is separated from the lateral condyle of femur by a meniscus that is called the lateral meniscus. Its anterior surface has a flattened impression, and its posterior surface has got a facet. This is the facet that is called a fibular facet. It is flat and circular, directed somewhat downwards and backwards. This articulates with the fibula to form superior tibiofibular joint. So this is the superior part. This is the intercondylar area. This is the narrowest part, and it has got a intertubercular eminence in the middle. This is the narrowest part between the two condyles. Superiorly, there is intertubercular space or possessing intertubercular eminence. Now the tuberosity. This we can say this is the tuberosity of the tibia. It has got an upper smooth part and lower rough part. This tuberosity below it is continued as anterior border. It is smooth in the upper part and roughened in the lower part. Now the shaft. Shaft of the tibia is prismoid in shape. It has got anterior border. This is anterior border. This is the medial border. and this one is the lateral or interosseous border. If we talk of the anterior border, it is sharp and somewhat S-shaped. As you can see, this is S-shaped. It is convex medially in the upper part and convex laterally in the lower part. It starts above at the lower end of the tibial tuberosity, and below it is continuous with the medial malleolus. This is called a medial malleolus of tibia. This is the anterior border. It is sharpest, subcutaneous, and forms the shin. This is anterior border. Now we can talk of this border. This is the medial border. It starts from the medial condyle above and extends to the posterior border of medial malleolus. This is rounded border. As you can see, this is the rounded border. Now we can talk of this one. This is the interosseous border or lateral border. It starts above from the lateral condyle and below it is continuous. In front of the fibular notch, this is the fibular notch, and in front of the fibular notch it gets stopped. It gets discontinued. Okay. Three borders are there. This is anterior border, lateral border, and medial border. Now the surfaces. We have got firstly lateral surface. This is the lateral surface. This is between anterior border and lateral borders. Between anterior border and lateral borders, we have got a surface that is called a lateral surface. Okay. This is lateral surface. In the upper 3/4, it is concave and is directed laterally. In the lower 1/4, as you can see, this is directed forwards. This is directed forwards. In the upper 3/4, it is directed laterally. Now we will talk of medial surface. This is the medial surface. This is between the anterior border and medial borders. This is subcutaneous, and below it is continued with the medial malleolus. Now we can talk of the posterior surface. It is between the lateral and medial borders. Between medial and lateral borders, there is the posterior surface. Posterior surface is expanded, somewhat triangular in the upper part, and the lower part it is less narrow. In the upper part, it has got a roughened line. As you can see, this is the roughened line, and we have the roughened area there. It's called a soleal line. Soleal line begins in front of the what we call the fibular facet, and it's directed downwards and medially and continues up to this. Below the soleal line, there is present a we can say a ridge, an elongated area, ridge that divides the posterior surface into medial part and lateral part. In its middle, there is present a foramen that's called a nutrient foramen, through which the nutrient artery, the branch of posterior tibial artery, passes. Now this is the posterior surface. Now we can talk of the lower end. As you can see, this is the lower end. It has got a medial malleolus. This medial malleolus, firstly, it is slightly expanded. It's not more expanded, it is less expanded than upper end. It has got 5 surfaces and this medial malleolus, a projection that's called a medial malleolus. It has got a anterior surface, medial surface, inferior surface, lateral surface, and posterior surface. If we talk of its anterior surface, it has got an upper smooth part and lower rough part. Now the medial surface, it is continuous with the medial surface of the shaft. This is continuous with the below with the medial malleolus. This is the medial surface. Now the lateral surface has got a notch for the fibula, and it forms a joint with the fibula called the inferior tibiofibular joint. Below it there is a roughened area, a flat area, smooth area below the notch. This is that notch that is flat and is covered with the hyaline cartilage. Now the inferior surface. This inferior surface is articular and it articulates with what we call the talus, trochlea of the talus to form the ankle joint. These are the surfaces. This is the posterior surface. This is the posterior surface of the medial malleolus. Now the medial malleolus is a projection, strong but it is short projection directed downwards, and forms the subcutaneous eminence of the medial side of ankle. I hope you have understood the anatomy of the tibia. Thank you.